I do a lot of work in operations administration in the emergency department, and as you look at growth and expansion, understanding the business of medicine and how hospitals run, health systems run, I think is a natural next step. AI, advanced analytics, those type of things are really driving a lot of healthcare right now.
As we review tons and tons of data every day, it became more and more clear to me that we didn't have a good way to analyze just the fire hose of information that was coming at us every day. And I wanted to know what factors were influencing the ways that we could improve patient care, see patients better and faster. I approached the chair of my department and said, what I really want is something that kind of marries data science and health policy, but also some business management skills. And I just felt that nowhere else really compared to what was offered like Fuqua did.
One of the really interesting things about the MSQM program that's different than a lot of the other ones is that it's driven through the business school. I knew when I left I would be getting the business concepts that I wanted in addition to some of the more cutting edge advanced analytics. And that, at least for me, was what made this program stand out. It's an all online program. We meet every Saturday for live Zoom virtual classes. And then the week leading up to and after is spent watching pre-recorded videos, reviewing notes and slides that the faculty have put together for you.
The schedule is really flexible, allowing me to do my studying and get the projects done on my time. They also offer a handful of in-person weekends that are optional, but most folks fly in for it because they're just so valuable in terms of not only the content, but the opportunity to spend time with your classmates and really feel that you're getting the collegial experience that you would look for from any degree, despite that it's a 100% online degree. So it's kind of the best of both worlds, I would say.
It's important to keep this in mind. Here's a slide that summarizes everything.
The faculty have a lot of real-world experience. They were an advisor with the company that you're doing the case study on. They work and are integrated in the laws that are being passed. That integration is amazing. I have applied something from every single class to my daily job since I've started. Within the first few weeks of starting the program, I started to understand some of the basics around advanced analytics, linear regression, and was able to use some of that into building models to help improve patient flow through the emergency department.
I just have this wealth of information that I've been applying and really wowing my colleagues at work because I'm bringing such a level of sophistication to the data analysis that we never have had before.
I think everybody knows that healthcare in America has got to change. If we're going to continue to succeed and we're going to continue to help provide high-level quality care for patients, we've got to change the way that we do business. And that means the way we do the business and the finance part of healthcare, but also how we take care of patients and how we leverage advanced tools to make sure that patients are getting the right care at the right time in a timely fashion that's high quality and patient-centered. And this program, from the business and the analytics side, absolutely does that.